Have you ever felt that unsettling burn in your chest after a nice family dinner and reached for an over-the-counter antacid to find quick relief? If you're 65 or older, this might be a familiar scenario, especially when favorite foods start to irritate your stomach more than they used to. However, there's a side to antacids that's not always obvious and can affect your long-term health in ways you might not suspect. Many older adults keep a small supply on the bedside table or in a kitchen drawer for those late-night bouts of heartburn, trusting these products to do their job quickly and without fuss. The issue is that antacids, while helpful for occasional discomfort, can become a crutch if used incorrectly. Instead of improved digestion and comfort, you may find yourself battling surprising challenges, from nutrient depletion to medication interactions. When you think about it, digestive health is linked to virtually every aspect of well-being. Good digestion can mean better sleep, more energy, and greater freedom to enjoy the simple pleasures of life, like your favorite home-cooked meals or social gatherings around the dinner table. Beyond the immediate relief antacids can bring, there's a bigger picture to consider. As we age, our bodies become more sensitive to even the smallest changes in diet, routine, and medication. Over-the-counter remedies are not automatically risk-free just because they're available without a prescription. In fact, for older adults, seemingly harmless medications can sometimes contribute to avoidable complications. That's exactly why this discussion matters. By addressing the common oversights many seniors make with their antacids, you'll have the chance to safeguard not just your digestive comfort, but also aspects of your overall health that may be tied to how you manage acid reflux or heartburn. There could be unexpected benefits, like improved nutrient absorption or fewer problems related to medication overload, once you refine the way you handle antacid use. The good news is that you don't have to give up your antacids altogether if they're part of a sensible plan. The aim here is to help you avoid pitfalls and use these products in a way that truly supports your health. Today, we'll explore 5 common mistakes people over 65 often make with over-the-counter antacids. You'll see how taking a simple step like reading the label more carefully can make a big difference, or how talking with a healthcare provider might reveal better alternatives or strategies. We'll also look into daily habits like diet and physical activity that can lessen the need for antacids in the first place. And if you stick with me through all 5 points, you'll come away with a clearer roadmap for healthier digestion, greater independence, and a sense of control over choices that might have seemed too complex or confusing in the past. I've had the privilege of speaking with countless older adults about their experiences managing heartburn and indigestion. Through those conversations, I've come to understand that there's a lot of common wisdom circulating that may not actually serve seniors well. My goal is to share insights that align with what many healthcare professionals now suggest for safer, more effective management of acid reflux and related issues in later life. As you listen, think about your own routines. Do you find yourself popping a chewable tablet every night before bed? Have you tried switching brands without really comparing active ingredients? Perhaps you've noticed that your heartburn is getting worse, despite regular antacid use. Wherever you're at, it's worth pausing for a moment and reflecting on these 5 mistakes. You might just discover a fresh perspective, or maybe even a small tweak that can create big improvements in your daily life. If any of this resonates with you, let's dive in and tackle these 5 points together. You might be surprised at how much of a difference a few small changes can make. And if you think you already know all there is to know about antacids, I'd invite you to stay open-minded. The landscape of senior healthcare is changing, and so is our understanding of how best to manage digestion as we age. Feel free to share your own experiences or questions along the way with friends or family. It's in these shared conversations that real insight often emerges. Mistake number 1 often sneaks up on people: over-reliance on antacids as a magic bullet to fix heartburn and indigestion problems. It's easy to believe that if a chewable tablet helps once in a while, then it's perfectly safe to take it every time you feel a twinge of discomfort. But there's a common misconception lurking here. Many seniors think the only way to control acid-related discomfort is to neutralize it immediately, no matter how frequently it appears. The reality is that when heartburn becomes a regular occurrence, it might be a signal of something deeper going on. Consider James, who is 71. For years, James had the odd bout of heartburn, usually after a large Sunday dinner. A few antacid tablets, and he'd feel fine within minutes. Eventually, he started experiencing heartburn daily, sometimes even twice a day. He didn't see it as a red flag. In his mind, heartburn was just another nuisance of getting older, and antacids were a trusty friend. By the time James mentioned this pattern to his healthcare provider, he was carrying antacids in every coat pocket and using them like breath mints. What James learned was that his consistent heartburn was more than just random flare-ups. His doctor explained that chronic acid reflux can lead to complications over time, including damage to the esophagus. And while antacids help in the moment, they aren't a solution for chronic issues. In fact, excessive use of some antacids might cause unwanted side effects such as constipation, diarrhea, or even an imbalance in electrolytes, a risk that can be especially concerning for older adults who are more vulnerable to such changes. To gain a new perspective, it's helpful to see antacids not as a one-size-fits-all fix, but as a short-term measure for occasional discomfort. When heartburn becomes a frequent issue, happening multiple times a week, that's your cue to talk with a healthcare provider. This professional might suggest a more specialized treatment plan or recommend lifestyle adjustments that tackle the cause of the heartburn directly. This is also a chance to consider other contributing factors. For example, do you eat late at night and then lie down immediately? Do you enjoy spicy foods or caffeinated drinks well into the evening? Small changes in these habits can make a world of difference. On a practical level, try tracking your heartburn patterns. Some people keep a simple diary of when it happens, what they ate, and how severe the discomfort was. Others might note the specific brand of antacid they used. By noticing a pattern, say you always get heartburn after a certain type of meal, you might decide to adjust your dinner menu or have that dish at lunch instead. The emotional benefit of this approach is a sense of empowerment. You're not relying on medication alone. You're actively influencing your well-being through informed choices. If you find this first point hitting close to home, take a moment to reflect on your own antacid usage. Do you reach for them more often than you'd like to admit? Share this insight with someone close to you or jot down a plan. Maybe try a new approach this week, like spacing out meals or reducing certain trigger foods. Feeling engaged with your own health decisions can be a huge motivator to keep going, even when it feels like a gradual process. Mistake number 2 centers on not reading the labels and ingredients carefully. Over-the-counter antacids come in many forms: tablets, liquids, chewables, and even dissolving strips. They're not all the same. The misconception here is that if one antacid works for you, any antacid should work just as well. However, the active ingredients can differ significantly, and certain additives might not be beneficial depending on your health situation. Meet Carol, who is 76 and living independently in a small condo. Carol prides herself on being quite savvy with grocery shopping deals, but she rarely thinks twice about the active ingredients in her medications. She knew she had a preference for liquids over chewable tablets. But beyond that, an antacid was an antacid to her. When she found a brand on sale, she'd grab it. Then one day, Carol's pharmacist pointed out that the variety she was using contained high levels of sodium. Because Carol also had mild hypertension, her healthcare team had recommended watching her sodium intake. Without realizing it, she'd been consuming extra sodium through her antacid, which was making it harder to manage her blood pressure. Beyond sodium, some antacids contain aluminum or magnesium compounds that can contribute to constipation or diarrhea if used often or in large amounts. Others may have calcium as the primary buffering agent, which some people see as a bonus for bone health, but can create problems if you overdo it or if your healthcare provider advises you to avoid extra calcium for any reason. Some chewable varieties even contain sugar, which might not be ideal for individuals watching their blood glucose. Reading the fine print on the label can save you from inadvertently aggravating conditions like high blood pressure, diabetes, or chronic kidney disease. A helpful new perspective is to see label reading as part of a broader strategy of informed self-care. The more you know about what's going into your body, the better equipped you are to tailor your choices to your specific needs. Instead of automatically picking the brand you always used, take a few extra minutes to compare labels. If you're unsure about an ingredient, ask a pharmacist or a trusted healthcare professional. Pharmacists are often underutilized sources of information, and many are happy to help you interpret labels and choose products that align with your health conditions. Once you find the right product, consider keeping it in a designated place at home. Attach a small label or note reminding you of the safe frequency and dose. That way you avoid accidentally taking more than recommended. There can be an emotional reward in knowing you're respecting your body's unique requirements. Rather than feeling forced or restricted, you can see this practice as an act of self-respect. You're acknowledging that your body at 65 or 75 isn't the same as it was at 25, and you're adapting in a healthy, proactive way. If you're realizing you haven't checked an antacid label in years, why not go take a peek right now? It might become a talking point with a friend who also uses over-the-counter medications. You can share tips on what to look for and compare experiences. These small acts of vigilance can add up over time, making a noticeable difference in how well you manage both your acid reflux and any other health conditions. Mistake number 3 often flies under the radar: skipping the conversation with your healthcare provider. It's easy to see why this happens. Over-the-counter antacids seem so routine, so trivial, that many people assume bringing them up in a medical appointment might be a waste of time. After all, your doctor is busy and you have more pressing issues to discuss than the occasional heartburn tablet, right? The misconception is believing that if something is sold over the counter, it must be universally safe for everyone, especially in the recommended dosage. But that's not always the case. Let's look at Barbara, age 82, who has quite an active social life, but also deals with high cholesterol and osteoarthritis. During one of her regular checkups, her doctor asked if she was taking any new medications or supplements. Barbara casually mentioned she used an antacid almost daily. Only then did the conversation reveal something significant. Barbara was also on a specific medication for her arthritis, and the timing of her antacid use was affecting how well that medication was absorbed. In other words, because she took the antacid around the same time as her arthritis pill, her body wasn't getting the full benefit of her prescription. Neither she nor her doctor would have discovered this unless she spoke up. This underscores how crucial it is to discuss even the smallest details with your healthcare provider. If you see a specialist, like a cardiologist or an endocrinologist, mention it to them as well. Each specialist looks at your health from a different angle, and what seems unimportant to you might be extremely relevant to them. Moreover, as we age, it's common to juggle multiple prescriptions for different conditions. Adding an over-the-counter medication without telling anyone can introduce new risks, including drug interactions, excess mineral intake, or unexpected side effects. To gain a new perspective, view your healthcare team as partners, not just problem solvers in crisis situations. You can proactively bring a list of all the medications and supplements you use, over-the-counter or otherwise, to every appointment. That includes vitamins, herbal remedies, and of course, antacids. The practical step here is to create a small medication chart you can update anytime you pick up something new from the drugstore. This fosters clarity and openness in conversations with your doctor or nurse, helping them give you the best possible advice. Emotionally, this approach can relieve you of worry or guilt. You're not bothering your doctor, you're helping them help you. If you've ever felt rushed in an appointment, consider this. The more organized and upfront you are with information, the quicker and more effectively your healthcare team can respond. It might even shorten future appointments or reduce the need for follow-up visits about issues that could have been prevented. If you feel a barrier, like maybe your doctor seems too hurried, remember you have the right to ask questions and ensure your health concerns are fully addressed. Some people like to schedule appointments specifically to review medications, providing a dedicated time to go through everything thoroughly. This might be a wise move if you use multiple medications or if your treatment plan keeps changing. Making it a routine check can also catch potential problems early, before they turn into bigger complications. Mistake number 4 is about the timing and method of taking antacids, especially in relation to other medications. Many older adults think nothing of popping an antacid tablet just after taking a prescription pill. The misconception is believing that as long as you take everything, your body will sort it out. But certain antacids work by neutralizing or reducing stomach acid, and that acid is sometimes necessary for proper absorption of specific nutrients or medications. When you inadvertently neutralize your stomach too much, you can reduce or delay how your body processes other meds, leading to either decreased effectiveness or unexpected side effects. To illustrate, consider Harold, 68, who was recently diagnosed with type 2 diabetes. He was prescribed a medication to help control his blood sugar. Whenever Harold felt a burning sensation in his chest after a meal, he took his antacid tablets right along with his diabetes medication, hoping to keep things simple by ingesting them all at once. Over time, Harold noticed his blood sugar readings weren't improving as his doctor had predicted. They were higher than expected, and nobody could figure out why. Only when Harold's son, who's a nurse, asked about his daily routine did the timing of the antacid come to light. Harold's antacid choice was interfering with how his diabetes medication was absorbed, blunting the medication's effect and leaving him with poorly managed blood sugar levels. A new perspective here is recognizing the importance of spacing out medications. Your doctor or pharmacist might suggest taking your prescription medication at least an hour or two before or after your antacid. Some guidelines say to wait even longer, depending on the type of medication and whether you're dealing with extended-release pills. Rather than being a burden, these schedule adjustments can be vital for ensuring that both your prescription medication and your antacid can do their jobs properly. A practical step to help with this is to set up a simple schedule or reminder system. You could use a pill organizer that's color-coded for different times of day, or place sticky notes in key areas around your home. If you use a smartphone or a tablet, consider a medication reminder app that alerts you when it's time to take each pill. By adopting a consistent routine, you'll reduce the mental load of trying to remember when you're allowed to take each medication. From an emotional standpoint, sticking to a medication schedule can enhance feelings of control and reduce anxiety. Many seniors worry about messing up their medication routines or being a burden by needing extra help. But establishing clear times for each medication fosters independence. You'll feel more confident that you're using everything correctly, and you won't have to constantly second-guess if you're missing a dose or risking a medication interaction. If you suspect you've been taking your antacid alongside other pills without giving it much thought, this could be the perfect time for a small experiment. Try spacing them out by a couple of hours and see if it affects how you feel. Of course, consult with your healthcare provider first if you have any doubts. But that small tweak might lead to better results from your prescriptions and fewer episodes of digestive discomfort. Before we move on to the final mistake, let's pause for a moment. Think about the insights that have emerged so far. Have you felt an aha moment around label reading or timing your doses? Maybe you've realized it's worth talking with your doctor about that nightly antacid habit. If you find any of these points resonate, take a moment to consider one small change you could implement this week. Could you commit to reading a medication label more closely or note the times you take your pills? Sometimes these straightforward actions serve as a powerful first step on a journey toward better health. If you're finding value, you might even jot down a quick note or share it with a friend who also struggles with heartburn. Mistake number 5 addresses a broader lifestyle misconception, ignoring the role of diet and daily habits, assuming that antacids alone can handle your heartburn or indigestion. Many seniors believe that digestive discomfort is just part of the territory and that relying on antacids is simpler than overhauling a beloved routine. While it's true that habits can be hard to change, especially if they bring comfort, overlooking lifestyle factors can trap you in a cycle of repeated heartburn episodes, creating an ever-growing dependence on antacids. For an example, let's turn to Gloria, who is 69 and loves her nightly ritual of dessert and coffee before bed. For years, it's been her way of winding down, perhaps indulging in a sweet treat or sipping a strong brew while catching up on her favorite TV shows. However, she started to notice that about half an hour after her snack, that familiar fiery sensation would creep into her chest. Gloria assumed it was just her body's way of complaining about getting older, so she popped a couple of antacid tablets and went back to her show. Over time, the heartburn worsened. She tried stronger antacid products, but the discomfort started interrupting her sleep. When she finally saw a doctor, she learned that both coffee and sugary treats can contribute significantly to heartburn, especially when consumed shortly before lying down. The new perspective here is that simple shifts in daily routines can often do more than relying on medication alone. Gloria experimented with moving her dessert time an hour earlier and swapping out coffee for an herbal tea. She also began sitting upright for at least 30 minutes after her late snack, sometimes flipping through a magazine instead of heading straight to bed. Within a couple of weeks, her nighttime heartburn was drastically reduced, and she realized she didn't need to rely on antacids nearly as much. The emotional benefit was a renewed sense of control and fewer disruptions to her sleep, allowing her to greet each morning feeling more refreshed. There are many practical ways to integrate lifestyle changes for better digestive health. Consider moderating your intake of spicy or acidic foods, limiting caffeine and alcohol, and giving yourself at least 2 to 3 hours between your last meal and bedtime. Gentle physical activity like a short walk after dinner can help your digestive system move along more smoothly. Even small steps, like elevating the head of your bed or avoiding tight belts around your waist, can help reduce the likelihood of acid reflux. It's not about eliminating every pleasure from your life. Rather, it's about discovering a balanced approach that respects both your body's needs and your desire to enjoy life. If you love your evening ritual, maybe you can modify it. Choose a lighter snack or a decaffeinated beverage. Or switch the time to earlier in the evening so your body has more time to digest before you lie down. From an emotional standpoint, these lifestyle tweaks can give you a sense of agency over your health. It's easy to feel powerless when your body starts to react differently than it did in younger years. But knowledge and small adjustments can act like the gentle steering of a ship. You might be heading in the same direction, but you steer just enough to avoid the storm. Over time, you'll likely notice improved comfort and maybe even additional benefits, such as better sleep or more energy during the day. Those are the 5 most common mistakes: over-reliance on antacids as a magic bullet, not reading labels carefully, neglecting to share information with your healthcare provider, taking antacids at the wrong time relative to other medications, and ignoring simple lifestyle habits that can dramatically reduce heartburn in the first place. Imagine the positive outcomes if you choose to correct just 1 or 2 of these mistakes. You might need fewer doses of antacid, save money, or prevent potential medication interactions. You could see an improvement in your sleep quality, feel more energized during the day, and enjoy meals without the looming worry of acid reflux. The real payoff, however, might be a renewed sense of confidence in how you manage your health. Knowing that you're making informed choices can lift some of the stress and anxiety that often accompany daily health struggles. The urgency is real, but it doesn't have to be anxiety-inducing. For example, if you rely heavily on antacids, that could be a clue that something else is going on, a clue worth investigating sooner rather than later. If you don't pay attention to the signals your body gives, you risk facing complications that might be prevented with a small bit of knowledge and action. There's no need to panic, but ignoring these warning signs can lead to bigger issues over time, such as ongoing esophageal irritation or even nutrient imbalances that sap your vitality. Consider how implementing these changes might look in your life. Perhaps you decide to keep a small notebook by your kitchen counter to track episodes of heartburn, what you ate, how soon you lay down after eating, and whether you used an antacid. You might find yourself cutting back on late-night snacks or planning an afternoon appointment to discuss your over-the-counter medications with your pharmacist. Each step is small enough to manage and can be integrated into your existing routines without turning your life upside down. Over time, these small shifts accumulate, potentially transforming your overall digestive health and your confidence in navigating the golden years. Now is the perfect moment to take action, because small steps today can prevent bigger problems tomorrow. If you're the kind of person who loves to share information with friends or family, consider mentioning what you've learned about antacids the next time you talk. You could be helping someone else avoid the same pitfalls. Or, if you're more private, simply commit to making 1 or 2 adjustments on your own and see how it feels. You might be pleasantly surprised at the improvement in your comfort level and quality of life. Here's a multi-layered call to action to suit wherever you are in your journey. If you're brand new to this topic, start by taking stock of how often you use antacids and reading the label of the product you have at home. That's a quick and easy first step. If you already knew some of the basics but haven't spoken to your healthcare provider, schedule a brief conversation or phone call to mention your antacid use. especially if it's frequent. And for those of you who are ready to make bigger changes, consider a more thorough lifestyle review. Keep a simple journal to identify trigger foods, experiment with meal timing, and even try light exercises after meals. If you suspect you need more specialized help, don't hesitate to discuss advanced options with a healthcare professional. No matter which route you take, remember that every small choice adds up. You're in the driver's seat of your health journey, and you have the wisdom of your life experience to guide you. By avoiding these common mistakes and tuning into your body's messages, you can maintain or even enhance your quality of life, enjoying the activities and people you love without the nagging distraction of persistent heartburn. You have the power to make these decisions. They may not always be simple or straightforward, but with each careful choice, you show yourself and everyone around you that age doesn't have to mean surrendering your comfort or independence. It just means you've gained the awareness to make even smarter choices for the years ahead. Here's to good health, better digestion, and a future full of enjoyable meals and restful nights.